So good afternoon, everybody. My name is Trish Brennan, and I am the Director of the Office of Education on Self-Directed Services, Priority Waiting Lists, and Special Projects at the Division of Developmental Disabilities. I have the honor to introduce to you, and the pleasure as well to introduce you to Dr. Jennifer Johnson. She is the Deputy Commissioner of the Administration on Disabilities, part of the U.S. Department of Health and Human Services Administration and Community Living. The mission is to equip individuals with disabilities of all ages and opportunities, tools, and supports to lead lives of their choice in their community. Its programs are working to create change and improve the lives of the estimated 61 million individuals with disabilities living in the United States by advancing opportunities for inclusion and participation in the community, employment and financial well-being, and independence and self-determination. Dr. Johnson has served as the Deputy Commissioner since September 2019, with a focus on improving the quality, accountability, and evidence base of AOD's programs and initiatives. Her 30-year career in government, academia, national organizations, and local school systems demonstrates a clear commitment to improving opportunities for people with disabilities to lead full lives in the community, with an emphasis on diversity, inclusion, and advancing a diverse array of programs for underserved and unserved individuals and communities. Before assuming her current role as the Deputy Commissioner, Dr. Johnson served as Deputy Director of the Administration on Intellectual Disabilities from July 2015 through August 2019, where she oversaw the $185 million budget and the President's Committee for People with Intellectual Disabilities, a federal advisory committee. In this role, she provided strategic vision to ensure quality oversight and programs achieving sustainable results. During her federal career, she has contributed to multiple interagency committees and initiatives to ensure representation on the perspectives of individuals with disabilities in the departmental efforts. She is currently leading AOD's interagency initiatives to improve the availability of health and prevalence data on individuals with developmental disabilities. So again, I hope you've all enjoyed the past day and the next day and a half, and I hope Jen is here to kick us off for the afternoon session today. So thank you, Jennifer, and go ahead.
Well, thank you so much for that introduction. I appreciate it. And I really appreciate being here with you all today. Thank you for having me. I wanted to start with a visual description for those who need it. I am a middle-aged white woman with long hair that's sort of salt and pepper color. I have black rimmed glasses on today, and I have a sweater on and a virtual blue background that has the ACO logo on it. So as was said, I'm Jennifer Johnson, and I'm the Deputy Commissioner for the Administration on Disabilities, and we are part of the Administration for Community Living, which is an operating division within the U.S. Department of Health and Human Services here in Washington, D.C. I am speaking in place of our Commissioner, Jill Jacobs, who was unfortunately not able to make it today due to a last-minute conflict that was beyond her control. So she deeply apologizes for not being with you today. She was very much looking forward to connecting with you all. She's a huge supporter of consumer direction and really wanted to join you. So she she sends her regrets to you all. It looks like you all have had some great sessions and are going to continue to have some great sessions through this conference. Looks like a lot of great sessions on self-direction, and I wish I could have attended many of them. I would have loved to hear Clarabelle's story and to hear about the brokerage services, just to name a few from the conference agenda. It seems like the sessions have been a great opportunity to hear about people's creativity and problem-solving strategies that are really solving the real problems with real solutions so that people with IDDD are living full lives in the community and living lives of their choosing, most importantly. I wanted to share a little bit about the Administration for Community Living, or ACL, for those who don't know us. For those who aren't familiar with ACL, we are part of, like I said, the U.S. Department of Health and Human Services, which is a very big department within federal government. At the Administration for Community Living, we believe that people with disabilities thrive when they are empowered to make their own decisions about their own lives and are fully engaged as value members of their community. ACL is committed to ensuring that people with disabilities are full, active participants in all aspects of community living, including learning, growing, playing, working, and being valued alongside people with and without disabilities. The Administration on Disabilities, or AOD, is a component of ACL, and we focus on creating change to improve the lives of individuals with disabilities by equipping individuals with disabilities of all ages, we are lifespan, with opportunities, tools, and supports to lead lives of their choice in their community. So our goal really is to move from experiences where people with disabilities are institutionalized, they experience isolation and discrimination, poverty, joblessness, and dependency, to a life where people are leading full lives in the community, where they're included and active participants, where they experience financial well-being and are independent and self-determined and leading independent and self-determined lives. And AOD accomplishes much of this through our various national grant programs. We fund the state DD network, which includes the state councils on developmental disabilities, the protection and advocacy systems, and the University Centers for Excellence in Developmental Disabilities. And we have those programs in every state and territory. We also have a discretionary pool of funds to support projects of national significance that we use to address issues of national need facing individuals with intellectual and developmental disabilities. We also fund independent living services, so that includes the state independent living councils and over 350 centers for independent living across the US and its territories. We also fund a traumatic brain injury state partnership program in 30 states, and we have 2 national resource centers, the National Paralysis Resource Center and the Limb Loss Resource Center. And it's through the work of all these programs across the US and every state and territory where they're helping to change how people with disability are living the lives they want as valued members of their communities. At AOD, our work lifts up and is led by the voices and actions of people with lived experience. In fact, many of our team members are people with disabilities. And so people with disabilities are central to everything we do. And they are telling us that that more work needs to be done, that they need more and better access to the community, to education, to healthcare, to housing, to jobs. They are also telling us that they want more opportunities to self-direct their services and supports to achieve greater independence. I think we all know that self-direction is one of the most critical tools people with disabilities can use to maintain their independence and dignity while receiving home and community-based services. It's an important alternative to traditionally delivered and managed services where agencies drive services and supports. Self-direction creates the environment where people can manage all aspects of service delivery by using a person-centered planning process. And while self-direction can vary, it typically lets consumers choose and dismiss care workers, configure payment rates, set worker schedules, and allocate budgets. And how powerful is that for people who are oftentimes not given those kinds of opportunities, where the others might just take it for granted? It is a given for many others that they make their own choices and couldn't imagine being in a situation where someone else is making choices for them about their life. But yet people with disabilities don't oftentimes get to make their own choices, as many of us know. So not only does self-direction allow someone to live with dignity, studies have shown that self-direction comes with many benefits for people with disabilities, such as improved flexibility and more culturally competent supports. Many different state plans and waivers allow for self-direction, and more people are using self-direction. There was a recent report, it was issued in 2022 from the Kaiser Family Foundation And they found that nearly 437 individuals self-direct some or all of their Medicaid, home, and community-based waiver services. And another more than 400,000 individuals self-direct their personal care state plan services. All states except Alaska offer at least one HCBS waiver with a self-direction option, and over half, 19 of 37 states offering the personal care state plan option, allow self-direction of those services. So this is very positive that, we see the numbers that we do, but we know that the numbers need to keep going up, and more people need to have the opportunity for self-direction until it really is the default option. Well, I guess it wouldn't be an option, it's the default, and it is what people are doing. So in terms of New Jersey, how are things going in New Jersey? Well, it's great to see that New Jersey has a self-directed option, and we've seen how your state really publicizes that information well. About the option to self-direct, with the state offering many resources to people with disabilities and their families. And that people with disabilities are using that information to use self-directed services. 33% of people interviewed as part of the New Jersey National Core Indicators are aware of self-direction, which is higher than the national average. So that, again, is positive for New Jersey. Despite the value of self-directed services, we know that many barriers make it hard to self-direct. And one of the biggest barriers is the lack of direct care workers. I'm sure this is an issue that many of you are aware of, familiar with, and deal with on a daily basis. The numbers are staggering in terms of the crisis. Nationwide, there is more than a 50% workforce turnover rate. More than 80% of providers are declining referrals, and over 60% are shutting down services. And we'll need more than 1 million direct care workers by 2030. And we know that if we're going to get there, direct care workers deserve more respect and better pay if we're going to get the workforce that we need to support home and community-based services. And so ACL is committed to finding innovative solutions to the direct care workforce crisis. Last year, we funded the National Direct Care Workforce Strategy Center to help states find solutions and strategies to improve recruitment, retention, and training of direct care workers that support people with disabilities and older adults to stay in the community and out of institutions. So this is a major initiative for us. It is both an aging and disability project to address the direct care workforce crisis and support states in developing solutions. And so this work is very much getting underway and developing. And so there's really a lot that will be coming from this center in the coming years. The family caregivers is also a critical partner in our system of support for people with disabilities. And that's because of the number of people, family members who are caregivers. We have more than 53 million family members who are serving as caregivers, and they're filling in gaps that are created by the direct care workforce crisis. ACL has been honored to support 2 councils that are focused on family caregivers. They are the RAISE Family Caregiving Council and the Supporting Grandparents Raising Grandchildren Council. These 2 councils brought together organizations representing the many diverse stakeholders across aging and disability organizations, caregiving and family organizations, and others. These councils developed the first ever national strategy to support family caregivers that was published last fall and delivered to Congress. This strategy includes many actions that the federal government has committed to addressing in order to create solutions to the caregiver crisis. Another way that we have worked to expand access to the direct care workforce or to care is through the Blazing New Trails for Community-Based Direct Support Professional Prize Challenge. that we funded just about a couple of years ago. And the reason I mention it is because the Collaborative of New Jersey was the grand prize winner of our challenge. They had created an interactive map that was really innovative because it helped to promote and expand access to person-centered, person-directed services and supports in New Jersey by making it easier for clients to find care workers. So we're hoping that through this innovation, and we know that through the prize competition, more states were following this model, and that it's, again, we're hoping that more and more states will adopt this model to make information about person-directed services more readily accessible and available to consumers. And we will continue to work with states and other federal agencies to address the workforce crisis through creative solutions like this interactive map. But the direct care workforce crisis is not the only barrier to self-direction. We all know that how societal beliefs, biases, attitudes, and also a big factor that impedes the freedom to choice and to live a self-directed life. 50 years ago, individuals with intellectual and developmental disabilities in particular, but many people with disabilities were hidden. All too often living in institutions, not welcomed in their communities, schools, and families were told that they shouldn't bring them into their own home, and the best place was for them to be living in an institution. So it was commonly accepted that an institution was not just a solution, but it was the solution. There were not low expectations of people with IDD. There were no expectations that people with IDD could lead full lives in the community. Slowly, because of the tireless work of many advocates, more and more people with disabilities are living among us. They are our schoolmates, our neighbors, our coworkers, and our friends. Yet despite that progress, we know that biases still exist, particularly for people with IDD. Society still has low expectations of what they can do and what they can accomplish. Far too many people still think that people with IDD can't make their own decisions, make their own choices. And we've been working to counter that belief by investing in projects that make sure people with disabilities are able to make their own choices rather than making decisions for them. We have funded over the years projects on supported decision-making, a topic I know you all have been covering in this conference. Our current project is the Center for Youth Voice, Youth Choice, or CIVIC. The Center for Youth Voice, Youth Choice does research, advocacy, and education about alternatives to guardianship. They also support youth with disabilities by talking about alternatives to guardianship and working together. CIVIC works with youth with IDD, families, supporters, and researchers from a variety of backgrounds. And they speak different languages and come from different cultures, but they're all working together to learn and share information about alternatives to guardianship. CIVIC has a group called an advisory board that is made up of youth with IDD and other advocates that help guide the center. And this is an extremely diverse group. And they're also supporting youth ambassadors who are reaching out to their peers to tell them about alternatives to guardianship so they are more informed about how they can be supported in making decisions about their life rather than just automatically being put under guardianship after leaving school. Also, as part of our commitment to support people making their own choices, we continue to fund the Self-Advocacy Resource and Technical Assistance Center, or SARTAC. The mission of SARTAC is to strengthen the self-advocacy movement by supporting self-advocacy organizations to grow in diversity and leadership. SARTAC has resources for starting a self-advocacy organization and resources on a variety of issues important to self-advocates, such as benefits, education, mental health, inclusion, just to name a few. They have many more resources for self-advocates. SARTAC also has a fellowship program, which is a year-long opportunity for self-advocates to develop and grow their skills as leaders in the self-advocacy movement. SARTAC has supported 36 fellows since 2017, And the fellows do projects where they are able to develop their leadership skills through the projects that they design and implement. So it's through these funded projects that AOD is working to dismantle societal beliefs about what we, people with disabilities, can do and achieve. But we can't do it alone. And that is where your work is so important and vital. We have launched another initiative that aims to make sure our thoughts, opinions, and choices are heard no matter how they get communicated. There are an estimated 5 million people in the US who experience disabilities or other conditions that impact their ability to rely on speech alone to be heard and understood. People who cannot rely on speech alone to be heard and understood experience widespread bias and discrimination from not being seen, heard, or counted. While there is a range of augmentative and assistive communication or AAC technologies that exist, along with the research that shows how they work overall, people who need access to ACC face issues to getting that technology. They also face issues in terms of being able to use it. And also there are issues around cultural competence in terms of the use of AAC. So this ends up further marginalizing an already multiply marginalized community of people. So we at AOD are tackling this issue. We recently funded a project that is going to explore how peer supports can be used to increase the use, both access and use of AAC by individuals who need it. So we're really excited about this new project and look forward to sharing results with you all in the future. In addition to all this work that we're doing, we at ACL are also engaged in many other efforts to improve home and community-based services, or HCBS. For example, we have engaged with advocates in the states to make sure that they know about and can actively participate in the state's implementation of the HCBS settings rule. As many of you know, this is an important rule that ensures people who receive HCBS receive those services in the most integrated setting. But the voices of people with disabilities who need those services are essential to making sure that the states are doing what the setting rule requires. And that is why we are investing more into building those grassroots advocates through a new project we funded this September. This new project will give people with disabilities at the ground level who face barriers daily with the resources, tools, and information they need to have a voice in the conversation about HCBS in their state. It's through this project that we're going to create the infrastructure that is needed for people to connect to other people so that they can join together and have a louder voice in advocacy. Because without their voices, your voices, decisions are going to be made that will impact your life. It's vitally important that people at the grassroots level are connected and informed so they can impact how those decisions are being made. And this project is going to help in building those connections amongst grassroots advocates. We are also working on housing, which is a critical piece of living in the community. We have a housing stock that has minimal supply of fully accessible housing. It's estimated that 0.5% of US housing is truly accessible for people with disabilities. We also have a real scarcity of affordable housing, and it is often not available in places where people with disabilities live. We know we all need to do more to connect individuals with disabilities with the available resources and to promote the development of accessible and affordable housing. For people with IDD, too often the only choices are to live in their family's home or to move into a provider-owned group home. But many prefer to live in their own home or apartment, yet can't find affordable, accessible housing. To help address this problem, ACL is funding the Housing and Services Resource Center, which provides resources and training and technical assistance to a wide array of people, including housing providers, state agencies, and individuals looking for housing solutions. We held a 3-part webinar series this year on housing challenges and innovative approaches and solutions to housing specific to those challenges faced by people with IDD who want to live in the community in the housing of their choice. And these webinars are available for viewing on the Housing and Services Resource Center website. In ACL, we are closely following the emergence of technology to support independent living. As many of you might be noticing, technology is often being considered as a solution to both the housing issue and the direct care workforce crisis. And COVID certainly gave a lot of momentum to this conversation when so many relied on technology to stay connected. And while we know that technology can be a great solution, and sometimes it's even a simple, desirable solution, it can also be a very slippery slope where technology is used to support a person where they are living, when in fact, people are the real solution to support a person living in the community. So at AOD, we are concerned about how technology might be overused and inappropriately replace people, and that robots might become the next direct care workforce. So again, we're closely following this issue and wanting to engage in the work as is evolving in the field. So as I close today, I want to talk to you about Marie, who is a young woman living in New Jersey, who has been self-directing for the past 19 years. And I want to talk about Marie because it is important that we all talk about these big issues facing the field and facing people with disabilities. But we all need to remember that there is a person out there who is living with these issues on a daily basis and using important services like self-directed services. Marie loves to work and volunteers at a church, and she currently serves as an usher at her church. If there is an option or service available within the self-directed service systems, she has tried it. So she's very persistent. Marie lived in her own apartment for 7 years and hired her own support staff before deciding to move back to her mother's home in 2019. She has hit bumps in the road with hiring support staff, and she has had 8 self-directed employees over time. Marie wanted to hire someone her age who would have fun with her, do arts and crafts, go to the beach with her, and shop. And it was important to her that her staff is soft-spoken, respectful of her, and shares similar interests. Marie loves to sing and is a member of an online karaoke group. She used goods and services to pay for sailing lessons, and she came in 5th place in a sailing race. And since COVID, she's also used goods and services to pay for virtual music lessons and virtual art classes where she learned to paint. She's sold 2 of her paintings, and her work is the winning art submission featured at this year's conference. So you might all be familiar with Marie. But Marie is a contributing citizen in the community and participates in 3 peer networking groups. She is a peer-to-peer mentor and has found her voice. She recently started participating in the Division Self-Advocacy Advisory Committee, and she really lives a full person-centered life. It is the people like Marie and her story as to why self-directed services are so important. And as I said, I wanted to share this story so we know it can happen and that there are real people out there using these services. But to know that there are also those out there who aren't using self-directed services who could be. So I really encourage you to think about those others who are out there who aren't benefiting from self-directed services, who don't know about self-directed services. I encourage you to find those people, connect with them, share information about self-directed services, help them learn about them, help them figure out how do I also do self-direction. At no time have I seen such a powerful need for strong voices. I'm sure many of you are familiar with the saying, nothing about us without us. This is more true than ever today as we work together to bridge the gaps in access to home and community-based services and advocate for advancements in promoting self-directed services. New Jersey clearly has made important strides in giving consumers opportunities to direct their own care services, like we heard in Marie's story. And we look forward to seeing more progress in this area going forward. I want to thank you for your time today and for your time and commitment in improving the quality of life for people with disabilities. And if we have time, I look forward to your questions.
Thank you, Jennifer, for your keynote presentation today. I'm going to stop record so that we can have a conversation for Q&A if you'd like to do that.
Okay, yeah, great.